Ladies and gentlemen, good afternoon. Thank you very much for coming back, and it's great to see such a full audience. We've got a couple of spare seats down the front. If anybody would like to join us, don't mind the fact that it says reserves for speakers. We'll give you your task of what to speak about when you arrive. No one's listening, are they? No? Okay. I thought it was quite good. Right. As a test, you failed. Okay, 12 o'clock. It's my absolute pleasure to invite Matthew Brown, Digital Technology and Lead Mental Health at the Wellcome Foundation. Is that right? Wellcome Trust. And Matthew's going to talk to us about a funder's perspective on digital technologies for anxiety, depression, and psychosis. And this presentation is 25 minutes. Matthew's going to give you a talk and then invite contributions and questions. And then straight after that, I'm going to take the opportunity to talk about two of my businesses and the work we're doing to unify patient data. And then at 12:45, our colleague Andreas Boven is going to talk to us about elevating mental health. So it should be a pretty packed hour. So thank you very much for joining us. Matthew, if I could invite you to come along and talk to us about your topics.
Thanks very much, Shane. Can everyone hear me in the back? I can see some nods. That's also blinding. I'm going to stand over here. So great to see everyone here. Thanks, Shane, for the introduction. As I said, my name is Matthew Brown. I work at the Wellcome Trust. Just a quick show of hands, the obligatory show of hands. How many people have heard of the Wellcome Trust? Oh, yeah, quite a few people. Good. Right, so I'm here to talk about our kind of digital mental health funding. Firstly, I'm going to give a kind of broad overview, introduction to Wellcome, kind of who we are, what we support. And then I'll go into Wellcome's funding model. So a lot of people might know Wellcome as an academic research funder based in the UK. And so we are all of those things, but actually we fund in some different models as well, and that might be relevant to this audience today. So I'll go into there. A couple of sort of pertinent examples of where we fund slightly differently. And then I've got a couple of topics with illustrative examples of work we have ongoing in those areas related to mental health. In particular, talking about kind of how we can fund new ways of data collection for mental health research and intervention and analysis methods, and then our approach to the wider ecosystem for mental health. Okay, so first, intro to Wellcome. So who are we? Sounds like everyone already knows who we are pretty much, but if anyone doesn't, we're a global charitable foundation. We're based in the UK. We're about 10-minute cycle from here down the Euston Road. And we've got the Wellcome Collection just next door, which is a great visit and free if you would like to go there. But our main mission is to support science to solve global health, urgent global health issues. And so we have an endowment that we have a small investments team that invest that endowment on the stock market. I'm not sure of the exact figures, but I think the endowment is around about £36 billion to date. And then we take the interest that team generates and we spend it on our mission. And what does that look like in terms of strategy? We have these four main areas in which we operate. So first is what we would call discovery research. And so that is fundamental research into us understanding how life and health work. And so that could be academic research given to researchers mostly in UK or in low and middle income countries. Then we also have three strategic priorities, and this is where Wellcome feels we can have particular impact in specific areas. And so the first is infectious disease, and so we have a goal to reduce the risk of escalating infectious disease in the places where the impact is likely to be highest. We have climate and health, and that is putting health at the heart of climate change action. So really making sure that in 5 years' time, no one can quibble with the fact that climate change is a big driver of health outcomes, and really looking for policy change there. And so we have a team currently at COP talking about that at the moment. And then the one that is probably of most relevance to this audience is mental health. And so for mental health, we aim to deliver a step change in our understanding and early intervention of anxiety, depression, and psychosis. And that is a global mission. So I myself actually work for a different team. I work for a team called Data for Science and Health within Wellcome. So we have a mental health team. I work for Data for Science and Health team. We work across all of these areas to help them build out innovative digital tools, technologies, and platforms to help advance their strategies. And the reason why I'm stood up here in front of you today is because I work very closely with the mental health team. Okay, so I told you a little bit about the mental health strategy, step change in early intervention for anxiety, depression, and psychosis. And so we recognize that mental health conditions are predicted to be the biggest global burden of disease by 2030. And these conditions can be really progressive and lifelong. And I know I'm preaching to the converted here, but we see very complex trajectories for people with mental health problems where they go, receive treatment, receive care, have to go back time and again. They get inefficient or inappropriate care, and this will last on and on throughout their life course. So our job really, our role is to help understand those mental health problems better, and also understand where we can intervene at the earliest stage to stop people's life courses and trajectories being derailed as a consequence. Okay, so on to Wellcome's funding models. As I said, that Wellcome operates a variety of different funding models to meet our needs, and we're quite flexible in this space. And so the most traditional one is grant funding to academic institutions, but that's not the only mode in which we offer funding. And so I've got a couple of illustrative examples to show how we can operate slightly differently in order to achieve the goals laid out. First of all, a broad remit of what we do and don't fund, very generally. So we do fund research and development. So we will fund research into how interventions might be working, their mode of action, and also developing those interventions better. And this might also involve early stage working together between companies and academics to help firm up the evidence base behind particular interventions and progress that thinking. So we'll fund both those things. We will fund also sort of further along the pipeline translation in these three areas. So mental health, infectious disease, and climate and health, as related to the kind of strategies laid out. And if you want more detail on that, you can go to our website. But we will fund clinical trials in this space as they're relevant to our mission. What we would class as out of scope is translation in other areas of science. And so we wouldn't fund a lot of translation in areas that are not mental health, infectious disease, and climate. We'd fund all the underpinning research through our discovery research schemes as a consequence. We also wouldn't fund implementation or rollout of interventions. So we want to fund the development of the interventions and the evidence base, but we then wouldn't go on and fund the implementation, rollout, scale up of those interventions. Now, we might be interested in funding the development of scale up of an intervention, understanding how you go about doing that, how to make it maximally effective, but we just wouldn't fund the scale up itself, if you see what I mean. And across all of these things, when we're looking to support commercial entities, these decisions are really made on the basis that projects will deliver significant public benefit. So we're happy to fund into the commercial space, but we need to be convinced that there's a compelling reason why a commercial outfit is the right one to progress a step change in our intervention for anxiety, depression, and psychosis. And if we're convinced on that, then we're happy to fund into that space. Okay, so I've got a couple of worked examples here of where we are either looking to or have invested in order to progress our aims. And one of them is kind of a more traditional Wellcome funding model, and one of them is maybe one that we're less well known for, but we have in our armory nonetheless. And so we'll start with the sort of less well-known one. And so this is an investment vehicle for digital mental health. And so we're in advanced due diligence at the moment with KHP Ventures, which is this UK-based venture capital firm based at King's College London. And they are looking at trialing innovative digital mental health products at seed and pre-seed level with the NHS as a test bed. And so we're really interested in this because we see this as a great way of taking digital mental health products which have enormous potential to be scalable, reach whole demographics of people that maybe traditional mental health products don't reach, whilst also getting them rigorously tested within the NHS that then provides a route for potential scaling. So we are in advanced due diligence, as I said, with KHP on funding that, and the mechanism that we call that is a program-related investment. So we'll be an anchor investor in this case. We would be due a potential return on any profits that are made, but we'd most likely look to sink those back into other relevant initiatives as they come up. And so that's a mode which isn't traditional grant funding, but nevertheless provides us with flexibility to work with companies. And there are other similar sorts of mechanisms that we have available to us. The other one, which is maybe more of a traditional one, is a digital mental health funding call that we have on the books for summer of next year. And so we're currently going through the process of working up the scope and remit of that call, but that may well be relevant to some people in this room, and to keep an eye out on our website. It will be focused on improving digital technology to aid early intervention, anxiety, depression, and psychosis. Now that scope and remit might, that broad scope and remit won't change, but there may be details in there that you'd want to be aware of. And so I'd encourage you to check out our website in the forthcoming months to be able to see what exactly that scope lands like. There are also other funding calls that are on that website that you can look to see what the sort of broad framework of those funding calls might take. And I don't imagine this one would be massively dissimilar. And that could well also be open to both researchers and academic institutions, but also commercial entities. So I'd keep an eye on that. I also wanted to talk to you a bit about some other areas which may be of relevance to this, this audience around sort of developing new ways to collect and measure mental health measures, mental health data that we are particularly interested in pursuing. And I think part of that is because at Wellcome what we see is a lot of, so for example, longitudinal population studies, which generate large quantities of data on individuals, and they chart those trajectories over time, which is fantastic for mental health research, but actually the time, the frequency and granularity at which we collect those measures is just completely divorced from the kind of dynamics of mental health symptoms that we know occur. And so people will fluctuate in mental health symptoms on days to weeks, whereas with longitudinal population studies, you maybe get 2 measures a year, if you're lucky, most likely annually, or even less frequent. So these snapshots, while useful, do not chart the full dynamics of mental health problems. And so we're interested in different ways that we could approach this problem. And if people have interesting ways of approaching this problem, I'd be interested to hear them. We currently have a call out for proposals for a supplier to help us look at the use of passive sensing, sensors and wearables in mental health research. And we're really interested in the kind of current infrastructure for the sensor pipeline in mental health. If you're a company or if you're an academic who wants to bring in passive smartphone or wearables data into your pipeline, what does that look like? What is the offer there out you, and how do you integrate that in? Also, how useful is it? What's the evidence base behind usage of these passive sensing measures for a clinically meaningful outcome that then people can use to guide care-based decisions? And then finally, how best to incorporate the voice of lived experience into these quite technical research programs. And so for the mental health team especially, it's very important that the voice of lived experience in mental health is incorporated across everything that we fund in the mental health portfolio. And so we'll be closely engaging with our lived experience experts and others to make sure that we're capturing sort of how you can engage with lived experience experts or people with mental health problems to ensure that, especially when you're talking about very sensitive data like passively collected data, smartphone data, wearables data, that this is done in a trustworthy and transparent way and doesn't cause kind of adverse reactions to the people who are participating. So the second thing that we ran was a co-convening in September of this year with Google. And we brought together some representatives of key parts of Google, so Google Fitbit, Google Takeout, and the part of Google that deals with their large language models, so Google Bard, to talk about the challenges and opportunities of leveraging this infrastructure for mental health research. So they have lots of pipelines that allows access for researchers to be able to use these kind of products. But actually, visibility is very poor. Not many people know that Google offered these products. And also, I think what we're lacking is real, tangible kind of impact case studies on how these have been used and used really well. So we brought together a series of academics, together with members of Google staff, members of Wellcome, to talk through each of these topics. We're writing up the meeting notes at the moment, which we'll release, and then there's enthusiasm for a series of white papers after that, which will list out the kind of call to arms in each of these areas and what can happen in order to move the field forward for understanding and intervening for anxiety, depression, and psychosis. And I should say that while we collaborated closely with Google on this meeting, actually, we're open to any tech company that offers these kind of products. Our objective is really just to make sure that kind of non-traditional data, in some sense, is being leveraged and used in the best way it can be for mental health research. And so whether that comes from Google, whether it comes from Apple, we don't really care. So this was an interesting test case for us. We may run others with other companies to see how we can best move the field forward and integrate these kind of data in that context. Okay, and so the final thing I wanted to talk about was a couple of examples of how we're approaching the wider ecosystem in the mental health and DSH challenge area. And so the first is regulation of digital mental health products. And so we have funded the MHRA, and they are collaborating closely with NICE to flesh out the guidance that they offer on how to regulate software as a medical device and what the evidence and evaluation metrics should be for those kind of products. And so we recognize that that space is a very challenging space to operate in, and we need improved guidance, but we nevertheless feel that that regulatory environment provides a key component of enabling kind of trustworthy tools to be developed so that people know what and how to choose, depending on what problems they have. And so the MHRA, relatively early days in this, they started in March, and they're going to start building out that program of work. They've been running a series of workshops with regulators. So I attended one last week, which had representatives from US, FDA regulators, also Australia, Europe, Brazil, the African Medicines Agency. So multiple different regulators say the focus here is on the UK system, but how can we ensure that we're coordinating internationally so that we recognize when we're scaling mental health products, they're not only sitting within one ecosystem, they have a broader ecosystem at play. There also will be running workshops, a couple of them, for industry and product developers, engaging with those entities, say, like, what are the challenges that you come across in regulation? What does the evidence base look like for you when translating a particular digital mental health product through that process? So that's at relatively early stages, but we hope to see movement on that in the next year to 18 months, that process. And then the last thing I wanted to touch on was informative clinical trials. And so ahead of our digital funding call, we've been doing a series of different scoping activities. And one of them is looking at how do we understand what an informative clinical trial looks like. And so see many clinical trials across many different areas of science. Some are more informative than others. We want to understand how you could go about building a framework to help you decide what an informative trial looks like and what a measure for informativeness could look like. So we've commissioned a supplier, I think it's Black Dog in Australia, the Black Dog Institute, and they'll be assessing how informative digital mental health trials have been. So what's the current landscape, how many trials are out there, and how have they helped to move the field forward? And then also identify the common elements that when a trial is failing or it's not generating useful information for the community going forward, what are the most common reasons for that? So why are those trials failing, and can we help try and prevent that in the future? With the ultimate goal to design more informative trials so that we can understand if we're funding a digital mental health trial, how can we maximize the chances of success? Great. So what now? I'd ask you to check out closely our website for new updates on both the Digital Mental Health Funding Call, but also the KHB Accelerator. If we have any investors in the room and you're interested in coming in with us on KHB, do come and talk to us. We'd be interested to hear from you. And finally, write to me if you have any particular kind of ideas or suggestions about the strategy. I think the strategy is set. If you have something that you feel can really contribute to the strategy, then my email address is here. Come and talk to me, and I can also forward you on to our great mental health team. And I'll leave my email address there. Thank you very much.
Thank you very much indeed. I think we've got about 5 minutes for questions if you're open for those.
Yeah,
Anybody got any questions for Matthew? We'll send the mic over to you. Yep, gentleman over there.
Hi there, thank you. That was super interesting. Could you maybe talk through a couple of examples where, it sounds like you're approaching such a big challenge, but are there any examples where it's working to the point that it can scale, or is this still very early exploration?
In terms of in terms of digital mental health products?
Yes.
Examples of where it can scale. I think it is still, it's still early days. We fund a couple of interesting projects. So we fund the Avatar project, which is a kind of VR-based project, which we are interested in scaling, and whether that can scale out to low and middle-income countries. Again, given just the nature of the infrastructure involved, that will never be kind of a fully scalable activity. But I think that we're biasing at the moment towards things that have tended to work in the lab with academics, and then we look at what the potential route is to scale. We also have a couple of interesting products related to more on the stratification side, so using natural language processing to identify speech biomarkers in psychosis, which is funded out of Manchester. So there are a few promising aspects, but I wouldn't say we've got a great example of like, this is the one that's made it at the moment. Yeah.
Thanks.
Well, can I just say, Matthew, on behalf of, I guess, industry and healthcare, thank you to the Wellcome Foundation, because it's clearly managed that endowment incredibly well over many, many years, and it's vital, the work that you do. So thank you very much indeed, and thank you for your contribution this morning. Big hand for Matthew, if you don't mind. And if you aren't running off, I've got some ideas on data, which I'm just about to share. Can I just take the clicker from you?